on the website for you to read them. I will respond in a written way any of the questions that you have and that I wasn't able to respond for lack of time. I am also going to ask you at the end, during the presentation and at the end, some quote-unquote polling questions so that we get better sense of what are some of the questions that you have and some of the areas where it would be good to focus on. We know that approaching services with a trauma-informed care lens is a very broad concept, and we talk about this, and we talked about this during the year, but we talk about this, and it's really hard to know exactly where is it that you would need some support to get started. So at the end of the presentation today, I'm going to give you some questions so that we can have more of a sense of where would you like to focus the other webinars on this mini-series. Today we're going to talk about two-generation programs. We're first going to be talking a little bit about the definition of two-generation programs, why they came about, and in some ways what are some of the problems that the two-generational approach can help you solve. Then we're going to talk a bit about adverse childhood experiences or toxic trauma care that we would like to use as a underlying basis to move your program in that generation, in that form. And at the end, I'm going to talk about some of the sort of basic strategies that all programs, especially two-generation programs, will have to begin by putting in place so that we can talk about trauma-informed care in two-generation programs. As I said, if you have questions as I am talking, please write them down. Some of them we will be able to respond to immediately. Some of them we will wait until the end, and I will submit to you a written response. Two-generation programs. Two-generation programs were born or grew out of the recognitions that in many of the programs serving communities, serving low-income families in communities, we were serving adults in the program many, many times without even knowing if they had children or not. And sometimes we were serving the children and we did not know what was going on with the parents. So to give you an example, sometimes on substance abuse programs, we would look at women or men, adults, men or women, and we would not even ask them if they had children or not. We started serving them with all the strategies that substance abuse programs have without taking into consideration what their role as parents were. And on the contrary, we were doing services for children that we knew that their parents were around because the parents bring the kids to early childhood programs and to child care programs, and because folks on what used to be AFCC, now TANF, used to bring the kids and were getting the service because they had children, but we didn't know in which ways this was affecting, the parents were affecting their kids. And we would not, importantly, we would not use the information either when we serve the kids or when we serve the adults in any capacity to become self-sufficient. We were not using that information to plan the services. Many of you who are parents know that sometimes we are called to meetings or we're called to all kinds of events of our children when we're working and we cannot leave our jobs. That is even more relevant when we're working with low-income families, which sometimes are paid by the day, and if they come to programs with their kids or to do things with their kids, they're not paid. So, and then we wonder why is it that parents are participating. So the issue came up with two-generation programs as to, how are we going to address issues of poverty and all kinds of the social issues that kids and adults start while supporting both the parents and caregivers in their efforts to become self-sufficient. The assumption behind two-generation possible is that we cannot promote good outcomes for children without recognizing that they grow up in families. This seems a lot, this seems very, as my younger generation would say, but it's not always what we do when we're serving the family. And the other side of the coin is that in order to provide or promote self-sufficiency, what all of you are doing in some way or another in any of the programs that you have, it is essential to be mindful of the roles and responsibilities and challenges, especially challenges in the case of trauma, that the parents have. So two-generation programs seek to promote linkages between high-quality educational services for children and workforce development services for parents. Sometimes it is done within the same program. Sometimes it's two programs that have funding sources and have different kinds of categorical approaches, and sometimes it is the same as we're going to see. So we have the linkages between the quality early educational services with programmatic efforts to help parents gain the skills that they need to become self-sufficient and to support their children. Two-generation programs are very familiar to probably all of you, because we used to call them at some point family-centered approach, in which we would look at the whole family in order to be able to promote the development of the child or sometimes of the adult. The difference when we call it two-generation programs and not family-centered approach to programs is that in two-generation programs we're looking at the outcomes, both of the parents and of the children. When we go from the child-focused program, as you see the drawing on the bottom of the page, that are child-focused, and that is, of course, child care is one, early childhood programs is another, the therapeutic programs that we have sometimes in mental health, etc. And then we go to the next level, which is the child-focused program with parent elements. So, for example, we had a program like a home visiting, or we have programs like the literacy programs that we had, early literacy programs that are prevalent in some areas. Even Head Start programs, which are child-focused because they have a very strong emphasis on child development, on the children, and all of you who have Head Start programs now know, for example, with the new Head Start performance standards that just recently came out, the focus on curriculum, the focus on the mental health of kids, and all of the new focus of the new and the old focus of the Head Start performance standards. In many of the Head Start programs, there are they include the families. They include the families for the policy council, for learning literacy, so that, and learning parenting skills, so that they become better parents, if you wish. However, not all of them are looking at outcomes both for the kids and for the parents. They're not necessarily looking at outcomes. They serve the parents in specific child-focused areas, but they don't look at the parent outcomes as the ultimate, one of the ultimate goals. And that's where a family-centered approach and a two-generation programs may differ. I'm saying may differ because in many cases they don't. In many cases it's the whole family approach. From the other side of the arrow that you see, we have a parent-focused program, for example, AFTC or TANF, and we have substance abuse programs, etc., which has child elements. While the parent is in any of the services that have to do with their own road to self-sufficiency, etc., the kids are taken care of in many of the, for example, I'm going to use the example of domestic violence programs, where many times we are providing the services to women who have been traumatized by violence, or men in the program, and we take care of the children sometimes in the best possible way, but we're not looking at outcomes in terms of the kids. We're looking at the outcomes in the case of the parents that are coming to our program. And at the very end, of course, of the other side of the equation, we have the parent-focused programs, which really focus on the adults, on the parents, and have, promote a lot of outcomes for the parents that do not look at the kids. In two-generation programs, we have usually a developmentally appropriate early childhood program. What does this mean? It means that we're very careful in the planning and the implementation of the early childhood program. We offered a broad variety of developmentally appropriate services. We also may have a parenting education program component, which looks at the parent in relationship to the child. What are those skills that the parent needs to learn and to learn that will help them become a better parent? And so that's the second one. And the third one is, of course, the adult education program, which has the literacy, the job skills, the training component, sometimes the funds program, everything that is going to help the parent on his search to become self-sufficiency. You can see at the end there in the drawing how all of these wheels turn out hopefully together, so that as we're working with one side of the equation or the other, we're very conscious and aware of how these two interrelate. And at the end of the deal, we are looking at outcomes for both. We are looking to increase the appropriate development of the child, and we're looking to increase the adult in their self-sufficiency. If there is any question about this, I would like you to write it down now. I'll try to figure out if we can respond to it, or we'll move forward and as I said, try to respond that later. It is not entirely important to move to this one first, and then we'll go back to that one. Okay? It is not very important that we actually have a very definite definition of two-generation programs and family center programs. And some of you may have the two programs, the child and the adult program, working on the same agency, although not in the same program. What is most important is that you focus on the issue that it is services for the whole family, and that you're going to be looking at the outcomes from the two areas and how the outcomes in one impact the other one. So as I said, two-generation programs are very, very similar to what you all know and you all do as family center programs. We're trying to emphasize here the issue that we need to be looking at the outcomes for both and how the outcomes for one impact the outcomes for the other. And if you have questions, please do that. Then we're going to move now to the area of trauma and toxic trauma and adverse childhood experiences. People use the word trauma. When people use the word trauma, they usually refer to an event which is very scary, which is it's either dangerous or violent, but it's very scary. And from a psychological perspective, trauma occurs when the individual, and when I'm using the word individual, I'm now using any age, from a baby, from a newborn baby to a very older adult. I'm using the word individual because if we're talking about two-generation programs, we're going to try to find out how trauma impacts the whole continuum of development. And so from a psychological perspective, what makes the traumatic event or the event become traumatic is the fact that it threatens or causes harm to our emotional as well as physical being. Okay, and this is an important one because trauma can be a natural disaster, a hurricane, a flood. It could also be war. It could be a car accident. It could be anything that is impacting physically our integrity. But it could also be that which is witnessing violence, sexual abuse, anything that threatens our sense of safety and security. And in the case of very young children, for example, a traumatic event may be something that threatens the adult caregiver, because children, as we know, especially very young children, depend on the adult caregiver, and when the adult is exposed to any traumatic event, the child feels that they may lose their parents, so it becomes traumatic for the child, and it becomes traumatic in many ways. Adverse childhood experiences, which is the research that is going on, has been going on nationally from I think it's been 20 years. You have a link there that you could learn more about this. A study done by the CDC and the Kaiser Permanente group, in which the original study was conducted in the mid-90s, and it continues up to 9. And they have found that adverse childhood experiences, what we call now like trauma or traumatic events, are circumstances that, negative life events or experiences that occur during childhood and have the potential to impede healthy child development, and therefore come to us as adults as symptoms of something that happened many, many years ago, and that we may or may not know where they're coming from. It's been found out that adverse childhood experience, and what I talked to you about traumatic events, are now the basis of many health issues like obesity, substance use, even diabetes, heart disease, and many of the factors that that impact us in our lives. Just wondering, this morning or yesterday, there was a big article on the news about how during the previous year, I think it was, there was a research that has evidence that has found out that people are, adults are dying now younger of health issues like heart disease and diabetes, and some people say you can't, some of the researchers say you can't base anything on just what happens in 1 year, but it's been the age at which these experiences have been showing, these sicknesses, these health issues have been showing, is decreasing. And you know, looking at the results of the adverse childhood experiences study, that we know how much of this is being the kind of violent and poverty environment that that we have been observing, and that now we see the results. Just a question. I don't have any response on that. It's just when this, I read this on the paper this morning, it seemed to me that that they may have some reaction. So traumatic stress reactions or adverse childhood experiences reactions are shown as intense and ongoing emotional distress, anxiety, behavioral changes, even with very, very young kids. And this, as I said, I'm talking about this general throughout the life cycle, but all of these symptoms we can see in adults and in children, of course, in developmentally ways. For children, for very young children, we see that after a traumatic event, after an adverse childhood experience, they cannot separate from their parents, they cry a lot, they have symptoms that indicate that something is not what it used to be before. With the adults, it would be probably in a very different way, but still emotional upset can be shown, as you know, in many ways. Behavioral changes, you know, a person that has been calm, or a child that has been calm after an adverse or traumatic stress reaction may become very upset, and et cetera. So all of these symptoms are throughout the life of a person, manifests itself at different ways at different ages, but they may be caused by the whole impact on the individual who's experiencing it. In terms of why it is important for two-generation programs to focus on traumatic stress, it's because of the impact it has on the family. And when we say the family, we go back to the concept of family-centered approach. If we're looking at the family as a unit, we need to see each one of the individuals, the child or the adult, and also how the family as a system and the subsystems of siblings and parent-child relationships work. And we've seen that adverse childhood experiences and toxic stress affects families in different ways. In the child, at the individual level, the child and the adult, we could see that we mentioned the fact that it has an impact on the mental health, on the anxiety for the child, on the learning difficulties for the adult, on the way to substance abuse or domestic violence, etc. In adult intimate relationships, obviously the impact of stress on one of the spouses or on both of them. And with toxic stress, we can say homelessness, poverty, domestic violence, environmental stressors, unemployment, etc., has tremendous impact on the way adults interact with each other. And on the parent-child relationships, definitely the trauma on either the child or the adult or both has a tremendous impact on the parent and child relationship. So the parent may be more absent, may not have the energy, the emotional energy to dedicate to their child, etc. So if we're looking at two-generation programs and we're finding out what are some of the issues that are impacting on outcomes, we need to focus on traumatic stress, because we know that from whatever angle we see it in the family, the trauma and the adverse childhood experiences is going to have an impact on either the individual child or adult, or on the parent, and on the parent and child. So that's where it becomes very important. There is a saying that toxic stress or adverse childhood experiences impacts both on partnering, who you choose as a partner, how you behave as a partner, and on parenting, how you behave as a parent. So that either way we look at it, if we're searching for in two-generation programs to impact the adult and the child, if we're going to look at outcomes of either one of them, self-sufficiency, mental health, etc., in the adult, or of developmentally appropriate growth in the child, we need to examine very carefully the impact of trauma on the life of the family. Again, I think Hyacinth just wrote there that if you have any questions, please don't hesitate to write it down. Families that are exposed to poverty, which is the families that you work with, all of you work with, face a disproportionate risk of exposure to trauma. And to families becoming what we call trauma-organized systems, that the system itself, the system of the family, becomes constantly, behaves constantly as if the trauma is still there, as if the trauma is still experiencing it as a crisis. It's always in a crisis-oriented mode. Sometimes when you have more long-term case planning that you do with your families, you know that it's really hard to get to some of the issues. For example, I remember working in Head Start programs, it was really very hard to get families to work on some of the child-related issues, because they're always in a crisis-oriented mode. They're always without employment. They're always, there's something that's coming up that becomes more important than working on reading a book to the child every night, or taking a child to therapy, or any of the fun things. We elaborate this, in some of the programs we elaborate these calendars where we say, oh, take your child to the zoo today. Well, you know what, if you don't know if you're going to have housing tomorrow, you're not going to take your child to the zoo. You're always working on a crisis, and so many of the families that are impacted by trauma are always in a crisis-oriented mood. And the other part of this is that it is intergenerational, because we learn to interact with our parents and with our partners based on what we see as families. What happens is that we transmit this to the next generation. So many of you have worked with several generations of the same family, and although you try to work on many of the issues that impede, that are, obstacles in their life, the way of, the chaotic way, the disorganized way of working in the family, as I said, of becoming a trauma-informed, a trauma-organized family system, it's transmitted intergenerational, and we see this happening in generations and generations. I want to ask you a question now which will help me see how much more would you like us to focus, probably not today, but in the next webinar series. How would you describe your level of understanding of trauma? That's one, of what is trauma, the different types of trauma, and of its impact on adults and of children. If you can tell me, if you can respond to that, it would help me know how much to focus. We sometimes repeat the same information, and I'm not sure if that's exactly what you need. So, how would you describe your level of trauma? Those of you that are in programs, how would you describe? Do you have a high level of understanding? You know about trauma. You know how it impacts. Moderate level meaning that you understand some pieces of it, but you really don't know exactly how it relates. And the very little understanding is the third one.
So this is Hyacinth. We just launched a poll. I see some of you are taking it, but if you guys can go ahead and please select your responses. We're actually going to discuss them once they come up, but you'll have about 90 seconds to submit your answers, so please do so. And please note how to approach these poll questions, because we actually have a couple more coming up later on in the presentation. Thank you.
You tell me when the time is done.
So you guys have about 30 more seconds to get your answers in. Okay, the poll is now closed, and if you give us a few seconds, we're actually going to read out the results for you guys, and they'll display on your screen.
What happened? Oh, I'm sorry. I'm sorry, guys. I don't really know how to do this. So there is very, very few of you that don't have any understanding, very little understanding. The majority have a moderate level of understanding. And so at the end of the presentation, I'm going to ask you again, what are some of the areas that you would like to see happening? Or you could actually write them as questions and tell me what are some of the areas of understanding, either of the understanding of the trauma itself, or of the impact on adults, or of the impact on children. And so that way we can focus on that. Moderate is probably okay. So we're moving right along, I think. I promise you I will read all your questions when we're done, and then I'll respond or answer to you either directly or I'm leaving this to my daughter and children. I'm becoming very knowledgeable. I believe every trauma event I go to, I learn something. So okay, thank you. That was a good feedback. You know, when you're doing this presentations, you really know if you're getting across in the way that you want it to, so I always appreciate your feedback, and such feedback is very helpful. So let's move on now to trauma-informed approach in two-generation systems. I think most of you, because you're in this webinar and because you live with this every day, will know or have a sense that trauma is impacting the families that you serve, children or the adults that you serve. And also that you've noticed either in your own life, and this is very important, in your own life that adverse childhood experiences or traumatic stress is impacting your life or the work that you do. And so it is not a matter of really convincing you. You're preaching to the choir. But there is a gap. There is a gap between recognizing that traumatic experience have impact current behavior, that it may impact our own personal life as such, or our children. And somebody wrote down, it's impacting my life and my children's life, so they know what I'm talking about. But there is a gap between knowing this or recognizing that this is an issue and really trying to build a trauma-informed environment across the continuum of care. And by the continuum of care, I mean programs that serve adults and that serve children in very, very different ways. Some of the programs, as I said before, are already funded to do this, and they're already asking you to look at outcomes of kids and of families. Others are beginning to think about how do we can't serve we can't provide all of the services for all of the families that they need because we don't have the resources, the staff, the funding, the capability to do that. So the issue that becomes for all of us is how do we begin to build a program that is there. Some of the programs are already 2 generations. Head Start programs are servicing both children and the adults, but some are not. And when they aren't, there are questions about should there be a change in service delivery, in what we do, in assessment, in staff awareness. Where do we actually start, or do we have to do a combination of all of these before we do anything else? And this goes to questions about, you know, obviously your service delivery becomes on your funding, on what your statute says you have to do, on your mission, on your vision, etc. And so it's hard sometimes to even begin to peel out that onion about where to go from it without actually moving into doing some things that you're not funded to do or that you don't really have the experience to do. And so what I'm going to do now is I'm going to talk about 5 different areas, 5 different strategies that you already are doing. It's not that we're asking you to do anything that you're not doing, but in having a trauma-informed approach, you would do it intentionally and systematically around trauma. Okay, so the very first strategy that all programs, and again, I'm not saying that in this way not saying that this is new for you, because you are already doing a lot of the work, but the issue around this now is how do we do it intentionally around with the information that you have on toxic care, on trauma-informed care, on the impact of trauma on both the kids and adults. And the first one is that we need to promote resilience. We have to engage both the kids and the adults. And when I say kids, I'm talking also about youth. Again, throughout the whole life cycle. We have to engage in efforts to strengthen resilience. Now, all of you do that already. But the good news is that around trauma, there are resiliency skills that can be learned. We know for sure that when children are exposed to trauma and they have a supportive adult, they are a lot more able to adapt to the circumstances of the trauma. We need to approach families from a position of respect. You do that already. You do it, I'm sure you do it in many ways on the areas that you are working on. However, around trauma, the issue is that to engage families about not what happened, not what's the problem with you, but what happened to you. Remember, we're talking about issues that may have happened many, many years ago, or that are happening actually now. And we need to engage the family with a position of respect and around their concerns. We cannot approach families with our concerns for them, but what is their concerns. The other piece about promoting resiliency around families impacted by trauma is that we need to engage the family. We need to let the family define what they can do for themselves and what we can do for them. And we can do that by focusing, of course, on their culture, on their traditions, on their values, on their lifestyles as building blocks. So the very important piece about a trauma-informed approach in both children and adults is around resilience and building resilience. Not adding a lot more to what you already are doing, which seems like an unbearable thing to do with all of the things that you already do and that you don't have time to do, but also focusing on promoting resilience from the perspective of the trauma. The second thing that we want to emphasize in all of the trauma-informed care programs is what we call screening. And the goal of the screening, of course, is identifying what's the immediate current issue that the family is focusing. And the screening the definition of screening is a process for determining whether there are concerns that warrant a response and what the response should be. When we say screening, and we say screening in families that you serve, in families that are exposed to poverty and that are exposed to the community issues that you know a whole lot better than I do, we're talking about everybody. I think you almost have to assume that the families that you're serving, or the children that you're serving, have been exposed to violence or to traumatic events. Research indicates that a very large number of families have. They may not be aware and conscious of how that is impacting their functioning now, but there are many screening instruments, both for children and for adults, that can help you identify which families have been exposed to violence. Without screening, routinely screening for the history of current trauma, we have to screen for history of current trauma and exposure to related symptoms. It is only when we do if we don't do the screening, we can usually prevent. If we do the screening, we can prevent misdiagnosis. Many of the symptoms of trauma exposure are identical to other kinds of things. In kids, for example, many kids that have been exposed to traumatic events appear as ADHD or having mental health issues, and if we don't know where they're coming from, we may not diagnose them to we may not appropriately respond to them. The first screening responses, and you have there a link to several screenings that you could do with, mostly with adults around violence. The other thing the other part that screening allows you to do is that it allows you to start talking about the issue with your family. They may or not be aware that that has an impact, and they may or not be ready. If you all know the readiness scales, the families may not, or adults may not be ready to admit or acknowledge that this is impacting. But the fact that you do screening and that you know that something like this has happened allows you to have a conversation with the families about the screening, the history of violence. The second part about the third strategy, we talked about building resilience. We talked about screening all of your families. The next one is you have is assessment. Assessment refers to is a comprehensive process. It evaluates several life domains in the child or the family. I have to be very clear. Assessment in the case of trauma is conducted by qualified individuals with appropriate credentials. It is both developmentally for the child or for the adult. It is something that they're individuals, psychologists, psychiatrists, social workers that are licensed to do that. It should not be something that any staff can do. Assessment does not necessarily have to be done. It would be wonderful if you could do it in-house. But if not, you would have the opportunity of referring the child or the adult for an assessment that would let you provide the treatment that is necessary. The assessment piece is a very important one, especially when you've done the screening, you know that there are some concerns, and you're seeing behaviors in your child or in the adult that indicate that the child or the adult may need more in-depth evaluation of what are some of the areas where they need to be. Again, assessment is the actual process, and for that reason, the assessment and the treatment needs to use culturally appropriate and evidence-based assessments. There is a variety of assessments that are available either for children or for adults. I did not include there the link because as I said, I think this needs to be done by a credentialed person, and so if you need more information on that, I'd be happy to give you that individually, but it's something that you need to be able to, if you have it in-house, to do in-house, which would be great, and if not, to refer outside. With assessment and with treatment of the trauma, it is very important that whoever is going to assess the child or the adult can come back to you and tell you in your services that you are providing what are some of the issues that you yourself can do. Assessment may be done by credentialed individuals, should be done by credentialed individuals, but that doesn't mean that the results are not something that you can use to more effectively connect with the family and to more effectively provide the services that you need to provide. The fourth issue that all of the trauma-informed two-generation programs should do is make resources available to children and the families and the providers on trauma exposure, on impact and treatment. we all have a sort of a resource box, or you develop resources as part of your agency to do many things. And so one of them should be to tell your families how to deal with an important issue as exposure to violence. So there are resources don't need to be very sophisticated. It could be a, a two-page pamphlet or something on what to do if your child is behaving this way. What are the places in the community that you can take your child? Why is focusing on the trauma exposure an important thing for the parents, for the adults, for the children, for the providers to do with the children. Sharing information on how adverse childhood experiences impact on adults and on children is a very important thing that you can do in your parenting classes. If you're offering parenting classes, talk about that. We sometimes talk about domestic violence, for example, or child abuse and neglect. We do it with an emphasis, in many programs, with an emphasis on the legal aspects of child abuse, on why, when to refer, what to refer, etc., but we don't make very clear what the impact is of this of trauma on the families and the children. And so by even parents or grandparents or caregivers that do not readily know that their behavior may be the product of adverse circumstances, when talked about this in a group, they may recognize themselves as, oh, I feel that way. This is the reason why I'm acting this way, etc. And the important thing about talking about violence and trauma and kids and families is that we need to finish with a hopeful message that whatever we're going through, we're not the only ones, but there are resources that we can provide, and there are ways that we can heal. I cannot tell you how many times I've spoken, for example, about domestic violence or exposure to violence in programs, specific programs for parents, and at the end of the meeting, parents come to me and say, well, that happened to my aunt, to my uncle, to myself, etc. And always there's somebody that connects what you're saying with what they're experiencing and what they're feeling and the way they are behind. So when I say provide resources, I say, I really say share information, share this information with the families that you're serving. Even if you don't think at the moment that these families may need this, specifically you would be surprised about how just opening that Pandora's box with people living in our areas and staff living in our areas opens up a whole level of hope for them as to there may be ways to deal with what I'm feeling right now. This may be one of the most important things that you can do in a trauma-informed care program, whether it's 2 generations, 1 generation, and it is to promote and maintain staff resiliency. The staff that works with families like the staff in your programs, you that are listening, the administrators that are listening, as parents, as providers, we are always very likely to develop many of the symptoms and programs of the staff of the families that we're serving. Those 2 o'clock in the morning wake up anxiety calls about I didn't do the right thing for this family, that child that sometimes we want to say I want to take him out of that family because that family is so dysfunctional. The everyday work that we do with our families are causes that we ourselves as staff have some of the develop and manage, we need ways to develop and manage strategies to avoid and address and minimize the treat secondary traumatic stress. And of course, to increase staff resilience. The same things that we ask staff to do with parents, that we do for parents, that we do for adults, that we do for kids, we should be very conscious about doing it for staff. I'm reminded of the times when we are asking staff to help families with domestic violence. We have them look at how they can develop a safety plan, how they can leave the family, if that the abuser, if that's what they choose to do, or protect the child or protect themselves if they cannot leave for many other reasons. But we don't do the same thing for the staff. We don't support the staff. And many times, staff comes from the same community and from the same environments that our families come, and we do not deal with that. Promoting and maintaining staff resilience is very critical. Staff that are burned out, chronic exhaustion, physical ailments, etc., may be due to secondary, what we call secondary traumatic stress. That means dealing with the stress that some of the families that they work with have. So if anything you can do in your program to start becoming a trauma-informed program is looking at how do you support your staff, okay? I have a question. Do you know of a trauma screen that is developmentally appropriate for very young children, for instance, the Head Start population? Yes, we do have some screens, and I don't have them right at the tip of my tongue here, but I will send it to you, and thank you for that question. It is an important one. Usually, screens with very young children are screens that include the parents, that of course is the parents telling you the story. But I will send you by email, or I'll post on the web some information on screening for trauma with very young children. Thank you. Thank you for that question. Again, any other question, please let me know. Working with other systems, that is another one of the issues around trauma that you need to take into consideration. No one agency, you could be the broadest of community agencies working in the community, but no one agency has all of the expertise and all of the resources to develop a comprehensive approach to families, both adults and children experiencing trauma. And there are such complicated and complex interrelated systems that operate in poverty, unemployment. There's poor schooling, substance use, etc. So it is a requisite, it is critical that you work with the other systems. The degree that you're going to be able in two-generation programs to work with, to become trauma-informed, is the degree to which you are successful in helping other agencies. And I just have a example of programs there. This is by no means exhaustive, but home visiting, Head Start, schools. Many times we connect with the Head Start and the early care, but then with the schools it's a whole different story. Runaway and homeless youth programs, housing, health, mental health, etc. We need to be working with these other systems to be able to coordinate the services that we're providing to our families. As I said, it is very, very resources are very stretched. Now they may become a lot more stretched in this environment 2017 that we're going into, and so collaboration with those agencies is a critical importance. When I say work with other systems, it sounds easier than it actually is, because if you're working, collaboration, as you probably know better than I, is very difficult. And if you're working on two-generation programs and you are searching for outcomes with adults and with children, you may depend on other agencies, on other systems to give you the feedback so that you can measure the outcomes of your program. You cannot do it by yourself. So it is important not only that you connect with the systems, but that you establish a coordinated way of feeding back and forth the information that you have, so that they can comply with all their regs and their funding statutes and the reports that they have to do, and you can do the same. You both have a lot of legal, administrative, practice, statutory rules that you have to comply with. And in order to be working on trauma-informed care, you're going to depend on each other to put all of these together. So as you decide to do this, look into what's already happening in your system. There are many communities that are now focusing on trauma-informed care. That include child welfare, that include mental health, that establish a continuum of care. All of those of you that work in systems of care kinds of environments, there are many systems that are now looking at collaborating and forging partnerships to deal with trauma-informed practice. And so it is very important that you connect with them. Those of you that are in more rural areas, sometimes it's really hard to connect with other systems, but you have to look into groups that are already collaborating with that. Tribal organizations that are working in tribes, with the tribes, are already starting to look into these collaborative partnerships that are looking into community-based systems of care and that are addressing trauma-informed care. Working with other systems, again, is very important. And when I say working, I'm really focusing on establishing common ground, looking at how how you can get outcomes for both, how you can communicate. Many of you have case managers that are duplicated case managers in the other systems. How the two case managers can work with feedback so that you can promote the outcomes that you're looking at. When we talked about assessment, a couple of slides away, we were talking about the importance of the assessment and treatment, the importance of getting the feedback from the other systems for you to be able to improve your own services and for you to be able to really use that as the base of your own outcomes and what you're reporting as part of what you're doing. So, as I said, look into groups that are already there and formed. If there is any one of you in your state or your community that doesn't know if there are some of this, you can ask that question and we can look and see if there's anything that's happening in the area of trauma-informed that can be helpful to you to join. And you don't have to rediscover the wheel. You can join that. Again, if there's any more questions, I'd like to take this opportunity to hear more about you. And what I'm going to do now is I'm going to actually do a couple of polls for you, which is going to tell me what you are already doing, and later on what we can help you with. In these strategies, I realize right now that I did not write other. You know, I wrote some of the ways that we usually do. We used to do trauma-informed care, but I didn't write other. But if there, the first poll, which I'm gonna do right now, is what strategies are you already implementing? I'm very interested in knowing what's already happening there. But if there are others that you're doing from what we've talked about that I didn't mention, I'm asking you to just write, oh, you look at that, she included other and she included all of the others. She's so smart, I tell you. I'm so impressed. Anyway, the issue is if you write other, I'd love to know what are they, okay? So here we go. What strategies are you already implementing? Training on understanding trauma, mental health consultations, providing resources on trauma for family, addressing caregiver parent trauma, providing secondary trauma, and by secondary trauma, I repeat, is helping staff with support. If you could answer this, and then if it's other or none of the above also, then that way we can have an idea. Maybe you can give them a little bit more time so that we can do the other, they can write down.
Sure. So we'll give everyone about 2 minutes to finish this poll, and if you do select other, as Elena just mentioned, please be sure to send it in to us through the chat. Not the Q&A, but the chat, so we can see it and we can maybe discuss them when you send them in. So you have about another minute to finish up. Thank you. We have about 30 seconds left. It still looks like quite a few of you haven't answered. Please be sure to just quickly answer our poll. I think we have this and maybe 2 more, but like Elena mentioned, we really are hoping to use this information and this feedback to provide you guys with tailored sessions, information, and resources that will help you be more targeted and direct in your approaches to trauma-informed care. So please do take just a few seconds to answer. We would appreciate that. Okay, the poll is now closed. Give us about 15 seconds, and we will display the answers for you guys. And I see that we had someone come in through the chat, so we will discuss that shortly. Thank you for sending that in.
Can everybody see the chat? Or no? We'll read it.
It depends on who they sent it to. So let's see. They sent it just to me, so no. So this is an other, but if you wanted to read maybe just the general answers first, then you can go to the other.
Okay. It sounds like many of you are doing training on, is that correct?
Yep.
So many of you are doing the training and understanding and providing resources. So there's several of you that are doing all of you. 6 of you are doing all of it. Okay. So
other we got is
the other. So, okay, let's see.
Either one of the big blocks is fine. So let's try the one at the bottom, which she resent to everyone. Thank you for that.
Is the same one?
Yes.
Okay. I work for the Department of Human Services in the Employment and Training Program for our TANF and SNAP clients. I'm only listening via audio. However, our division is trying to implement a more two-generation approach to addressing our client base, especially those clients that have been on TANF for several years. Okay, I'm so glad that as part of the TANF program, you're already looking at the two-gen. Are you doing or are you interested in doing anything related to trauma-informed care for both? And is this, has this webinar been helpful in outlining some of the, I hope this question, I'm not going to ask you the question, but I hope this webinar has given you some more ideas about what you could do to become more trauma-informed for both the SNAP and the TANF program. And we're looking to mainly address barriers. Many of those barriers are domestic violence, which you have mentioned, okay? There is a large number of the TANF population that deals with domestic violence, and when, very importantly, when you're looking at it, it is very critical that you also know what's happening with the kids. You know that when there is domestic violence in the home, usually the children are impacted in many more ways than one. So it's critically important to know where the kids of those families are in order to be able to serve the both generations. Julie, I would be happy to send you information on addressing domestic violence in both the kids and the families exposed to domestic violence, if you want that. Links to programs that you can use as models to help you in what you're doing.
Thank you for that, Julie. And if you are interested, you'll find my email at the end of this presentation, so it'll probably be easier.
Sure.
You, Julie, or anybody that is interested in learning more, you guys can go ahead and
sure.
send me an email, and I will forward them on to Elena, and she will be sure. She's very prompt. She'll be sure to get back to you with plenty of good.
You bet.
You guys can see that at the end of the presentation, and I'll pause and draw that out for you guys. So I didn't get it.
No, that's
Make sure that anybody, if you have a question or want more follow-up, or there's something specific that you would like more information on that might not have been touched on today, since this was kind of a broad overview,
sure.
Feel free to reach out to me and I'll connect you to Elena.
Sure. How about we do the other poll, and then we address all of them. How difficult it would be for your agency, for your program, to implement the trauma-informed approach in your two-generation program? And then the following one is going to ask you why. So
the poll is now open. Again, you'll have about 90 seconds to respond. If there are any supplemental information or questions that you have, again, please send them in the chat. You have about 30 more seconds to respond. But it looks like a lot of the answers that are coming in, most of you are responding by saying that it's somewhat difficult to implement a trauma-informed approach. So, Elena, did you want to speak maybe a little bit to that?
I'll do it when we do the next one, after we do the next one.
Okay. So you have about 10 more seconds. If you haven't submitted your answer yet, please do so. Okay, we're going to go ahead and close the poll. All right. So there's...
Okay, so there's the last poll.
So give me just a moment.
can you do others with that too?
Okay, so did you want to read this aloud so people know we're moving on?
Yes. So this question is, what barriers are you currently facing in your efforts to implement a trauma-informed care? And it is related to the previous one in that I'd like to know what are some of the, I mean, you said somewhat difficult, so I would imagine there are some barriers to it. So I would like to know if it's resources, fiscal resources. You don't have the money. By money, I also refer, fiscal, I also refer to the staff time. You don't have the staff or the time to do that. Agency competing priorities is the other one. Adapting policies and procedures, staff training, lack of support from leadership, not knowing where to start. Don't know where to start. And again, we're adding others, so I'd like to get some feedback about what are some of the barriers that you're finding in your agencies. I mean, I can understand somebody had mentioned as a barrier before unemployment. That's a very important barrier for your families, you know, that they're unemployed and therefore cannot participate. But I'm talking now in your agency. What are some of the barriers that you're currently facing?
Okay, so the poll is now live. Again, you'll have 90 seconds to answer. And if you submit other, we would love for you to provide an explanation in the chat window as well. We have about a minute left. You can still see that about half of you haven't taken the poll yet. Yes, we can see the numbers. So if you could please answer just one question, we promise it's the last one, and we're nearing the end of our presentation. But if you could please be sure to answer the poll, we would really appreciate your feedback and your contribution. Thank you.
Those of you that are on the phone, when you go back to your agency, and you can't, you know, do this right now, but when you go back, if you have any ideas or any thing that you want to tell us, just send us an email, and because I realize some people are just on the phone.
Right.
So those folks, it would be great to do that. And those of you that are responding, thank you so much. This is going to be very helpful for us. I appreciate very much the time to respond to this.
So it looks like the results are displayed right here, and then we have some other explanations. So did you want to?
Yeah. Well, there's not there's adapting policies and procedures, and there's the staff training. So there's sort of a smorgasbord of everything. Not
looks like most people said
adapting. Yeah.
But okay, we can go to the others. So
yeah.
Thank you to those of you who submitted in the chat box. So it looks like the first one that we see is from Julie again.
Okay.
Or from Clarissa, sorry.
Hold on. Let's see. I can email you. Okay. Finding a model for implementation rather than developing from scratch. Okay. So it is tough to send you a model for implementation, but I think it is very possible to send you examples of agencies that have done it, so that you could see that when you say a model, it's hard for any agency to just replicate a model. But by giving you some of the strategies that I mentioned before, I think that it would be taking those strategies, building resiliency, screening, assess and treat, providing resources. You have already a list of the strategies that will not be developing from scratch. So that may be a way, Julie, to start the process. And others said we would have to adapt some of the two-generation policies in our local welfare office. We have 80 in Pennsylvania, which are beginning to talk about in conference call. Okay. Mary Jones, I think you're telling me, correct me if I'm wrong, that you are already doing this, adapting some of the policies. One of the ways that we could help you out is by outlining some of the policies that need to be changed in order, or some of, maybe let's not put it on the negative, that need to be changed. Let's put some of the policies that should be in place so that it would be easier for the service delivery people to start implementing trauma-informed care. But it sounds like you're already doing it in conference calls. So if we provide you with some ideas of policies that others have found useful, you can bring those up at your conference call. Concerns about agency liability, staff giving advice to people with mental illness, for example. I don't know that you're giving advice to, you would have to review that, but it's not about giving advice to, you will not become, and I've been very clear about the fact that assessment has to be done by a credentialed individual. You will not be providing therapeutic services because those have to be done by agencies, by personnel that is licensed to do that. What you will be doing is approaching families in a way that allows for this to happen. If you need to do any treatment, you would have to refer that to the agencies that have the mental health agencies or the private mental health professionals that will do that. In no way you will be doing giving advice to people with mental health. It would require staff training and adapting some of it. Yes, it would require all of that. Staff training is always important, and adapting policies and procedures, as we have seen before, is too. Policies and procedures that include, for example, all of that has to do with supervisors, that has to do with accountability, about, all of that. So yes, you would need to be doing that. Any other question that you would like? We're almost at the end of our presentation. I'm encouraging all of you that couldn't answer or couldn't question today to send us an email. It would be very helpful for us to program, to develop our next steps and to see where you would like to go in this effort. So. Thank you so very much for your patience. You wanted to say something else?
Yeah, we have a couple of completing slides. I'm just going to slide back in. Okay, so thank you everyone for participating. We really do appreciate your feedback, and please know that we are going to use that to inform our further webinar presentations and other things that we offer to you guys. So please know that, we're not just collecting it just to collect it. We do very much have the intention of reaching out to you and being proactive to help you guys bridge that gap, because as we know, trauma-informed approaches, it's basically organizational change and changing the way that you approach and think about your programs. And it's a little bit less concrete than some of the other things we deal with, so we know that a lot of resources and guidance are involved. So we're here to help you, so please let us know if you have questions or concerns. So thank you to our wonderful presenter, Elena. Thank you for sharing your time and your expertise with us today. We do want to be mindful of your time. We do just have a couple of concluding slides about some other events or upcoming activities in the learning community. So if you have a couple minutes, just stick around and we'll just go through this quickly. We'd like to highlight some of our upcoming webinar events. We are very excited for the next one that we have, which is going to be on December 19th, and that is going to be the kickoff of our racial equity webinar mini-series. And that is going to be facilitated by Michael Wenger, who is actually a professor at GW, and he has written a book about his experience with white privilege and how that impacts the daily lives and the way that we approach different elements of our society. So we are very excited about that. Please be sure to register for this event. You can actually click on the title on your screen and that will take you right to the registration page for this event. So we do hope that you will join us for that. Also, we have another upcoming webinar event. This will be our first webinar of 2017, and it's going to be Learning with the Learning Community. So that's going to include the LCRC team, which is myself, and some of our other colleagues. And we're just going to be talking about what we've learned so far in year one of our cohort, what we can expect from our groups going forward, the different resources that we have to offer, and we would love to hear from you guys, your feedback on different topic areas or strategies or approaches that you are interested in, and that the ways that the learning community can provide those resources to you. So please register for that event as well. We hope that you will be there to join us. Again, we really do appreciate all of your feedback. If you wouldn't mind taking the survey so we can know how impactful, how helpful this webinar was, we would really appreciate that, and we'll use that to inform our webinar presentations going forward. And also, by participating in these webinars, you are a part of the learning community. We do want to highlight that. All of your participation, your efforts, your interests, your questions, that's part of what we do in the learning community, which is our efforts to showcase innovative strategies, but also to identify what the issues and problems are facing our network. So we would really love if you could take just a few moments to fill out actually our evaluation survey. Right now, you are participating in a webinar event that has to do with our trauma-informed approaches to alleviating poverty groups. So if you wouldn't mind taking that survey and filling it out, we would really appreciate your feedback. Again, here is our contact information. As I mentioned, you can see my email address here on this slide, in addition to my colleagues Tiffany Marley, who's our project director, and Jarl Crocker, who is the director of P&PA here. So if you have any questions, please feel free to email me, and those of you who raise things that you would like specific follow-up about, please email me, and I will be more than happy to connect you with Elena.
She'll pester me, so go ahead.
If you haven't checked it out, please do so. It's available at lcrcweb.com. All of our resources, all of the webinars that we've done so far are available on there, and you can also actually go on there and learn about the different learning community closed groups that we are facilitating, which are cohorts of agencies that are interested in receiving specific TA and really digging into certain topics. One of them being the trauma-informed group, but we also have others on financial empowerment, bundling services. So if you're interested in what that looks like, what they're learning, the progress that they've that will actually conclude our presentation for today. Thank you all so much for joining us, and we hope that you enjoy the rest of your day. Thank you.